The Corrections Department's independent office of the Inspectorate, Te Taritirohia, has found that between October 2020 and September 2021, nearly a third of the prison population had been kept in solitary confinement for a number of months and in some cases years, which has had harmful social and psychological impacts. The Department of Corrections acknowledges the report has accepted all 7 recommendations. Neil Beales is Chief Custodial Officer at Corrections, Arapautama Aotearoa, and is with us now. Tēnā koe, Neil, thank you for joining us.
Kia ora, Neil, thank you for inviting me.
So what's Corrections thinking about the outcome of this review, and was it surprising to you?
Well, Corrections thinking around the review, we welcome it. It's a welcome report. It provides us with a very clear steer of the expectations from the Inspectorate moving forward. The results are not necessarily surprising to me. I've worked in this industry for long enough to understand the use of segregation. The Inspectorate does point out in the report right at the beginning that the use of segregation or confinement is a legitimate tool to be used in prison for all the obvious reasons. What she is asking us to do quite rightly is do better, is be better when we do it, understand the impact that this has on the people, be better at recording the data so that we've got better insights as to who has been subject to whatever form of segregation for how long. And that will help us to understand the longer term impact for the people so that we can actually treat them better in the long run.
And what are some of the obvious reasons that someone might need to or be put into solitary confinement, and for what period of time?
It will vary. Sometimes we have to segregate people for their own mental health. They may be at risk of harming themselves or harming others. It could be for good order and discipline of the prison system. We may have somebody who's intent on disrupting the operation of the prison through either means of violence, either attacking the facility, property damage, etc. It could be that somebody needs to be segregated for their own protection. We have, unfortunately, a number of people who come to prison and they are under threat for various reasons, either the nature of their offence, they may have run into problems with other prisoners or through gang issues. So there's a variety of reasons why we may need to segregate people. I mean, what we need to remember is prisons by their very nature are a form of segregation. People are being segregated from the community. We have people who come to prison who then still present the very same risks and dangers that brought them to prison to begin with. And we have to have mechanisms in prison to be able to safely manage those people. And that means sometimes separating them from the mainstream. What we need to do, quite rightly pointed out by the inspector, is understand it more, understand it better, and record that data more coherently.
Okay. Now, I don't think anyone at all would be able to suggest that you've not got a very difficult job to do. So how might you change encounters in solitary confinement to a more perhaps therapeutic setting, so when prisoners are reintegrated back into society, they have some better coping mechanisms?
Totally. I think we need to train our staff more in the mental health aspects of it. I think over recent decades, we've come to learn much more in prisons about the level of mental health issues that prisoners come to prison with, and is then exacerbated by prison itself. We can no longer just accept that prisons are places where people have done bad things come to. It's also places where people have got significant mental health issues. Some have got alcohol and drug issues. Some have been excluded from education for most of their life, and some have all of those factors. Some have grown up in very violent households and come from very violent backgrounds. This creates a very, very difficult and complex mix of people that we have to look after in prison. So we can no longer just expect people just to be placed in a cell, wait their time out in prison, and then be released and thinking that we've somehow fixed them. We've got to do more in that mental health space to be able to support people whilst they're in prison, whether they're in segregation or not. And that means working more closely with our mental health providers. We've invested a tremendous amount of money over the recent years in upskilling or enhancing our psychological services in prison, but we've got more to do.
Neil, one of the more concerning aspects of the report was the inaccuracies with data collection and poor record keeping. What are some of the changes being made to help address this?
So the chief executive has already instructed a senior member of his team to start looking at the whole system and where improvements can be made. And a lot of that will be around that data collection. I will be talking to the field myself as part of custodial practice around raising the standards of making sure documentation is done correctly, it's done accurately, and it's done in a timely fashion. I think what the report has also brought out, if you look through the report, particularly when you look at the appendices, is there is a tremendous amount of data that is collected, but it's collected in separate fashions from each other. So one site might collect theirs, another site might collect. It's not centrally collated, and trying to extrapolate how long somebody has been in one form of segregation or other can often be difficult, especially when somebody may have been subject to several forms of segregation over the course of their imprisonment. So we need a better system. So I know that there is a dashboard underway right now. It was already underway prior to this report, which is going to give us more real-time information so that we can attend to concerns when we see them. If somebody is tracking over a certain period of time, we can start delving more deeply into it and get the multidisciplinary teams involved. So that is one of the key things I think that we have to work on. Okay. And then if you couple that with the greater understanding and more mental health provision, I think we'll get to a much better place.
Yeah, wonderful. Okay. Sounds like you're confident in this area, but obviously a lot more work to do still. All the best for that. Neil Beales from the Department of Corrections, thank you so much for joining us today. Tēnā koe.
Good. Thank you.